Thank you. Over.
Good morning, everyone. Thank you so much for joining the Rural Health Advocacy Project and the Healthy Living Alliance's webinar to discuss what we should think, or what are some of the things that we should have in our minds when the Finance Minister Tito Mboweni takes the podium in the next couple of weeks to discuss our taxes and budget allocations. Particularly, it is important right now as we are facing the COVID-19 pandemic, as we all know, and we have seen, particularly from a health perspective, the connections between non-communicable diseases and COVID-19, and how people who have comorbidities such as diabetes and hypertension and other non-communicable diseases are more susceptible to severe and serious cases of COVID-19, including death. And so as we think about this, particularly in the context of creating policies and creating policies that are pro-public health, that are to the effects of in making sure that South Africa's population and South Africa's healthcare users are better, are healthier and better supported by the government, we thought it would be important to have this discussion around health policies, tax levies, and how they work, and how they can be used as a tool to promote public health and promote a healthy nation. My name is Pontsho Pilane, and today we're joined by our esteemed panelists who will be going through some presentations around what is the importance of health promotion levies, as well as other tax ways in to protect public health and to promote public health within South Africa. And to kick us off, we have Corne van Walbeek, and he's going to be giving us a presentation that will be looking at how the tobacco tax has been effective and what are some of the takeaways and key lessons that we have taken from that. Corne, thank you so much for joining us, and please, we're looking forward to your presentation.
Good, thanks very much, Pontsho, and much appreciated to be part of this panel today. So I hope that you can see me. I've asked Andy to share my slides. I've got about 8 slides that I'll be working through. And if there are any questions, of course, you're more than welcome to address them to me. This is also a joint effort with my colleague, Sam Philby, who's also part of the audience today. So we're looking at health promotion levies and excise taxes in South Africa. The difference is very technical between what is a health promotion levy and an excise tax. I'm not going to spend too much time about that, but basically what it comes down to is that you have basically a tax that is levied on very specific products with the aim to reduce the consumption of those products. Next slide, please. So if we have a look at specifically the excise taxes on alcohol and tobacco, their history goes back a very, very long time. In fact, it goes back to at least the 17th century. And the primary focus of those taxes were to generate revenue for the state. Remembering at hundreds of years ago, income tax did not exist, and the taxes were collected either as a poll tax or more specifically as a tax on products. And already in 1776, the father of economics as a discipline, Adam Smith, wrote this rather famous quote that has been cited in this kind of literature many, many times. And it says, "Sugar, rum, and tobacco are commodities which are nowhere necessaries of life, which are become objects of almost universal consumption, and which are therefore extremely proper subjects of taxation." Right, slightly old-fashioned English, but basically what it comes down to is sugar, in the form that we currently think about it as sugar-sweetened beverages, but of course we can expand that. Rum, alcohol, and tobacco, primarily cigarettes, but not only cigarettes, are very, very specific products that can be used to generate revenue for the state. If we look at the more modern version of excise taxes as a means to change consumer behavior, that is a fairly modern approach to taxation. And only in the 1990s do we see that especially tobacco taxes have become fashionable, not for raising revenue primarily, but primarily to change consumer behavior to reduce the consumption of those products. Next slide, please. So if we have a look at South Africa's experience with health taxes. So in 1994, at the dawn of democracy, the incoming government made it very clear that they want to focus on primary health care, reducing the number of sick people. And one of the ways that they could do that is to reduce tobacco use. And they've been incredibly, or the government has been incredibly successful in doing that, basically on two pillars. On the one hand, increasing the excise taxes, and on the other hand, implementing legislation that makes smoking less desirable, less normalized, and so on in public places. And we see as a result that there's been a substantial decrease in tobacco consumption over time. We'll get to that later on. So in the early 2000s, what we see is that alcohol taxes receive significantly more attention, and the excise taxes on alcohol have been increasing substantially, but not hugely, since the early 2000s. And again, that was very much a focus on reducing the harms associated with alcohol use. And the 3 alcohol sales bans that we've had over the last year clearly indicate that whenever there is a significant reduction in alcohol consumption, there is a very significant reduction in trauma cases as well, cases of domestic violence, etc. Where the South African government was innovative and particularly successful is that the formula that they imposed on taxing the alcohol products was on the alcoholic content, not necessarily on the volume of the beverage itself. So in other words, in the case of beer, we see that not the quantity of beer is being taxed, but the alcohol within the beer is being taxed. What that does is it creates an incentive for the producers of that product to reduce the alcoholic content. And as just an anecdote, we see that, for instance, Castle Light has become very, very much advertised and has become a relatively popular drink, even though it is probably cheaper to make. It certainly carries a lower excise tax because it's got a lower alcohol content than normal Castle. And it's probably a bigger source of revenue for the producers of the product than normal Castle would be. Why? Because these companies have the incentive to reduce the alcoholic content, because alcohol is on the base on which the excise tax is being levied. If we look at spirits, typically spirits is taxed, or rather has got an alcoholic content of 43%. But over time, we see that a number of spirits have come up with 37% alcohol as opposed to 43% alcohol. Why? Because spirits is taxed on the alcoholic content rather than on the volume of the product. So in 2018, after a very arduous process, eventually we have a health promotion levy imposed on sugary beverages. This is a tax that is levied on South Africa only. It's not part of the Southern African Customs Union, which includes countries like Namibia, Botswana, Eswatini, and Lesotho. The excise taxes apply to all 5 countries. The health promotion levy only applies to South Africa. So that's where the difference comes in over there. And again, the formula encourages product reformulation. The tax is levied not on the volume of the sugary beverage, but on the sugar content of the sugar beverage. So after a fairly long negotiation process, the initial formula has changed quite significantly. And currently the first 4 grams per 100 milliliters is not taxed, but each subsequent gram is taxed at a certain rate per gram of sugar. the incentive is there for companies to reduce their sugar content, ideally to below 4 grams per 100 milliliters, because then it's completely tax exempt. But if it's above 4 grams, it will only be taxed from the 5th gram onwards. Next slide, please. So if we have a look at excise tax trends for alcohol and tobacco in South Africa. So we don't have good data yet for sugar-sweetened beverages because it's only been around for 2 years or 3 years. But excises have been levied on alcohol since at least 1910 in South Africa, and even before the formation of the Union, we also had excise taxes levied on these products in South Africa, recalling that at that point in time, the focus was on revenue rather than on the health effects. If we have a look at the green bars in this diagram, it shows us what is the excise tax on cigarettes where we have taken out the effect of inflation. All right, so we all know that inflation causes prices to rise over time. As economists, we've got a relatively simple way of removing the effect of all prices rising. So what this green line indicates is this is the excise tax on the product, removing the fact that prices have been increasing dramatically over this period of 60 years. And what we see is during the 1970s and especially the 1980s, the real value, in other words, the inflation adjusted value of excise taxes dropped very, very sharply. And the reason why that was happening was because the excise tax is levied as a so-called specific tax, a certain amount per 20 cigarettes. At the moment, that amount is 17.40 Rand. It was substantially less during the 1980s. And if you don't adjust your excise tax on an annual basis, basically what happens is inflation comes and erodes the value of that excise tax. And we see that that happened very sharply during the 1980s. Then from the early 1990s onwards, we see that there's been a very significant increase in the excise tax on cigarettes, especially during the 1990s in relative terms. And that process has been continuing right until today, although in fairness, over the past 10 years, the increases in the excise tax have been relatively modest in comparison to the period between the early 1990s and 2010. What we see for beer and spirits, where we see it on the blue line and the red line respectively, we see that throughout the 1960s and 70s and 80s, there's been a very rapid fall off in the excise tax on those two products. Primarily, again, because of the fact that the excise tax is levied as a specific tax, i.e. a certain amount per volume at that point in time. And the inflation eroded the value of the tax very dramatically during that time period in exactly the same way as it did for cigarettes. Then from the 1990s through to the early 2000s, there wasn't much happening. And then from the early 2000s onwards, we see that there's been an increase in the excise tax on beer and somewhat more on spirits, in line with the policy of the government to tax the excise, or rather to tax these products on the alcoholic content, but also to maintain a particular total tax burden on these particular products. And over the course of the last 10 years, that burden percentage has increased. So at the moment, the government is targeting a total excise tax burden on spirits of 48% and of beer of 35%. On wine, which I'm not showing over here, the excise, the total tax burden on wine is 23%. So the sum total of VAT plus excise tax is approximately 23% of the retail price of those products. The excise tax burden on cigarettes, or rather, let me rephrase that, the total tax burden, which includes VAT on cigarettes, is in the order of about 50 to 55% at the moment. Next slide, please. So just to get an idea of what is the relative importance of health taxes for the fiscus. Let's be honest, the government's financial system does not fully depend on excise taxes. In fact, of the alcohol tobacco and sugary beverages taxes, those taxes in total comprise approximately 3.5% of total government revenue. But nevertheless, 3.5% is a substantial amount. If we have a look at the budget for 2020-21, in other words, for the current financial year that is now soon coming to an end, we see that the numbers over there indicated in millions of rands are as shown. We got there the budget numbers and the latest estimate as indicated by SARS and the National Treasury of how much the government expects to collect. And if you have a look at the first two columns and you compare them, it's very clear that the government is going to be collecting substantially less than what they had anticipated. The main reason for that is because of the ban on cigarettes sales during 2020 of 20 weeks and the 3 different bans on the sale of alcohol during that same time period. And we see that revenue is probably going to be down in the order of about 30% relative to budget. A similar kind of picture is shown there for cigarettes and cigarette tobacco, as well as pipe tobacco and cigars, where primarily because of the ban that we had from March through to August of the sale of these products, there's been a significant reduction in the revenues that the government is expecting to collect from these specific products. But in normal times, and let's assume that 2021, 2022 is going to be normal again, these are the typical numbers that we would be expecting. Of course, another aspect that comes into play over here is the very poor performance of the economy. Without income, people don't spend money on things. And that probably explains why the health promotion levy on sugary beverages is down as much as what it is. There was never a ban on the sale of these products during the past year, but because sugary beverages are often regarded as luxuries and non-necessities for most households, we see that there's been a substantial decrease in the revenue collected from the health promotion levy on those products. Next slide. So the question is, are health taxes effective? So I'm a specialist, if I may say so, in tobacco control. I've looked at tobacco for nearly 2 decades, and I've been watching this particular diagram grow over time. And what we see on the red line is cigarette consumption. And you will notice that during the 60s, the 70s, and the 80s, there was a very rapid increase in cigarette consumption. It was also associated with a decrease in the real price of cigarettes. So the slightly taller bars over there, the blue ones, are the real price of cigarettes. In other words, the price of cigarettes with the effect of inflation taken out. If we have a look at the purple bars, that is the excise tax. So the excise tax during the 60s and the 70s comprised approximately 50% of the retail price, and it became significantly smaller during the 1980s. And that decrease in the excise tax resulted or was associated with a decrease in the retail price of cigarettes. Then things changed in the early 1990s. You see rapid increases in the excise tax. You see rapid increases in the retail price of cigarettes as a result. And you see consumption of cigarettes is dropping like a brick. From 1991 through to about 2007, we see that consumption of cigarettes dropped by about 1/3 on aggregate. And that was not as a result of illicit trade or anything. That was a real decrease in consumption. What we see over the past 10 years needs a little bit of explanation. So let me try and explain. The red line is formal tax declared consumption. In other words, cigarettes that have been declared with SARS that have had fully excise tax paid on them. We all know that over the past number of years, there's been an increasing problem of illicit trade. My best guess, based on work that my colleagues have done, is that the total consumption of cigarettes over the past 10 years can probably be best approximated by that yellowish line that you're seeing over there. It's running down ever so slightly, so there's a decrease in total consumption of cigarettes. But the difference between that yellow line and the red line, that is our best guess or our best estimate of what the illicit market is. And the illicit market had been substantially large in 2017. It was probably at its maximum at that point in time. It made a somewhat of a recovery in 2019, where it became somewhat smaller. And of course, in 2020, things are just off the charts. So we don't want to talk about 2020. The numbers aren't sufficiently out yet. But what we see is that the real price of cigarettes have remained pretty much constant over the past 10 years. The excise tax has been increasing ever so slightly, but not very much. So that means that the net of tax price has been decreasing somewhat as there has been competitive pressure in the cigarette market. We also see the illicit market over there. But the important message that I want to bring across is that increasing the excise tax, which increases the retail price, has got a very real effect on consumption. Right, that is a very important lesson that we can see from this particular diagram. And that should be, I think, the take-home message. Next slide, please. So for alcohol, we don't have data going back quite as far. But if we have a look at per capita alcohol consumption over the past 25 or so years, what we see is that South Africa is very much a country of beer drinkers. So more than half of our alcohol consumption is in the form of beer. Wine is increasing ever so slightly as a share of total alcohol consumption in South Africa. And what we also see is that sorghum beer is pretty much being annihilated and has become very much insignificant as a form of alcohol consumption. If you look at this stacked bar, it's clear that alcohol consumption at approximately 8 liters of pure alcohol per person per year is relatively high. It's substantially higher than the African average, which is in the order of about 6 liters per year. And what we also see is that there's a movement towards, let's call it, more westernized and more modern drinks as opposed to old-fashioned drinks. So often we hear the comment of, if we were to increase the excise tax, people are going to buy or rather make their own home brews. Well, to the extent that sorghum beer is one of these traditional beers that get drunk in traditional society, we see that sorghum beer is very much becoming old-fashioned and is becoming very much out of favor with alcohol consumers. So the comment of, if we were to increase the excise tax on alcohol, it's going to result in people making their own concoctions and making their own home brews and so on. There's really not all that much evidence for it. Next slide, please. So the excise tax structure matters, and I want to talk about the word structure at the moment. So the public aim of an excise tax is, the public health aim of an excise tax is to reduce the consumption of the product. The way that it works is that the excise tax gets imposed, it increases the price of the product. By increasing the price of the product, it becomes less affordable, and that reduces the consumption. And we see that that works pretty well for pretty much all products. The law of demand, which says that as the price goes up, consumption goes down, that applies also to addictive products like tobacco, alcohol, and sugar-sweetened beverages. However, if you choose your excise structure appropriately, you can also incentivize supply-side responses. And Karen's going to talk about it substantially just now. And excuse me. Basically, what she's going to show is that companies, because of the sugar-sweetened beverage tax, have reformulated their products so that they become less harmful, so that they contain less alcohol, so that they contain less sugar, and so on. And that is a very strong incentive effect that results from an appropriate tax structure. An inappropriate tax structure on alcohol would be where you levy on the volume of the beverage as opposed to on the volume of alcohol in that beverage. An inappropriate tax structure for sugar-sweetened beverages is where you were to levy the tax on the volume of the beverage as opposed to on the sugar quantity or the sugar content of that beverage. In the case of cigarettes, it doesn't really make sense to go for that because all cigarettes are pretty much harmful in the same kind of way. And for that reason, you would want to tax all cigarettes at the same rate, which is what is happening at the moment. Next slide. With that, I'm going to finish off. If you have any further comments or questions, please contact myself. You can also contact my colleague, Sam Philby, and we will try our best to try and address your question. Thank you very much.
Thank you so much. Thank you so much, Corne, for that. Corne is from the University of Cape Town's research unit on the economics of excisable products. And as in his presentation, he has showed that, you know, when we look at over time, that excise taxes and health promotion levies do work, they do decrease consumptions. And just taking over from what Corne was presenting on, Karen Hofman is going to carry on to talk about particularly the health promotion levy, known simply as the sugar tax, and why it needs to be at 20% for it to be effective, and how can and what is the public health incentive to put it at 20%. Karen, thank you so much for joining us and looking forward to your presentation.
Thanks, Pontsho, and very delighted to be here today. Thank you. Can we have the first slide, please? Thanks. Great. Thanks very much. So just to remind everybody on the call, although I'm sure everybody does know this, that sugar is a major non-communicable disease, NCD, risk factor. Sugar, particularly in liquid form, that's the key, has a particularly high risk of obesity, diabetes, and hypertension, cardiovascular diseases, many common cancers, including breast and colon cancer, as well as dental decay. And the WHO has noted, as has the Cancer Research Program for the Global Research Program, that individuals should consume no more than 10% of their calories from added sugar, preferably less than 5%. And to remind everybody that a single 600 ml bottle of regular soft drink, cold drink, provides 12% of total calories. So we're already over the top if we have one of those single 600 mils. Next slide, please. This is to show you that just drinking one sugary beverage a day increases the adult likelihood of being obese by 27% and the childhood likelihood by 55%. Next slide. And in particular, overweight adolescents have a 70% chance of becoming overweight adults. This is really critical because the number of sugary drinks that are being marketed, particularly to the 15 to 25-year age group, is significant. Next. So this is, as I said, BC here, health spending BC, before COVID. The government expenditure on health for this year was projected as about 14% of GDP. I don't want to go into the details of what it is now because it's really over the top. Next. What is the cause of all of this? Much of it has to do with diabetes and hypertension. Most diabetics, about 60% of diabetics, are not diagnosed. These numbers are showing you what diabetes is costing the country on an annual basis, 2.7 billion, and hypertension is costing South Africa 10.5 billion just in the direct costs. When we talk about the diabetes costs, this includes all the complications. And the wards of South Africa before COVID were not just filled with people who had suffered trauma, but were people who have diabetes and have lost their legs. and they have at least 5 amputations before they die. So this diabetes story is pretty bad and is scheduled to go up. And the indirect costs in terms of hypertension, which include the costs of families having to lose their jobs because they're taking care of a patient with a stroke, renal failure, etc., are also hugely significant. So the 2030 projection, which is when the SDGs we assume will be met, I doubt it, is projected at 35 billion, which is about 7% of South Africa's GDP. Okay, it's not insignificant. Next. This, ladies and gentlemen, is about the commercial determinants of health. What are commercial determinants? They're not viruses. They are factors that influence health which stem from the profit motive. Okay, these corporate activities shape our environments and determine the availability, promotion, and pricing of consumables. They are all the things that Corne spoke about. There is clear evidence also that food marketing deeply influences children's choices. As I said to you before, if you're an adolescent and you're overweight, 70% chance you will remain like that for the rest of your life. These harmful corporate practices have powerful deep pockets and are marketing unhealthy foods to children. This is not something that we can cure with a vaccine. Next. So in 2019, prior to COVID, and this, not much of this has changed. In South Africa, there were low, generally compared to the rest of the world, low advertising costs, pretty weak regulation. Industry shift to emerging economies, people in the West, in North America, in Europe, have shunned sugary beverages now for several years. The market for SSBs in South Africa has doubled in the last 2 decades, and it is very much focused on the poor. That is the industry view of the emerging markets. Let us focus on the poor. And there really is a conflict of interest between regulators, government officials and industries, regulatory capture, and industry-funded research. It's really important as the media to understand that there's a lot of industry-funded research going on. And when things are published about food in general and drink, find out who funded that research. Next. So this was some work that we did several years ago, just to show what would have happened, and indeed it has, because the sugary beverage tax did not come into play until 2018. When we started this work in 2012, 2013, we looked at what the cost of inaction would be 5 years afterwards. And there would be 1.2 million more obese people, and about 300,000, just over 250,000 of that was from sugary beverages. People have no control, really. You think you've got control over what you're eating and drinking. You have been told from an early age by your environment, not your family, but by your environment, what to buy, what to consume, what to eat, and we're continuing to do this to our children. Next slide. So as everybody probably on this call knows, and I'm not going to go into the details, there was an extensive timeline from the time that we started doing the research on sugary beverage tax with peer-reviewed publications. And then in 2016, a 20% tax budget speech was announced, followed by a major engagement with industry and public comment, outrageous job claims from industry, which were refuted, more public hearings, and eventually in April of 2017, a 10%, more or less, 10, 11% tax was announced to go on in 2018. Next slide. So Corne has already alluded to this. I won't go into the details, but this black line was the policy that was initially thought to be the most useful, about 20%. And then it was changed after a lot of discussion between industry and Treasury to base this on the sugar content with anything above 4 grams to be taxed. So you can see if that was changed down to 2 grams, the tax would go up. It would be closer to, the orange line would be closer to the black line. Next. So when this health promotion levy was introduced, and it's still the case today, there were exclusions. Nectars, juice, drinks, and juices with added sugar, as well as 100% fruit juices, were excluded by the Treasury. In case you didn't know this, most fruit juices contain more sugar than a regular cold drink. So if you have a freshly squeezed orange juice, 5 oranges, more or less, that's 10 teaspoons of sugar right there. And if you drank a Coke or equivalent, 330 mils in the old days, that is 8 teaspoons. So to think that fruit juices are healthier is just plain wrong. And the advice that we are giving is to eat your fruit, don't drink it. Next slide. So would the public support the taxes? People say, oh, the public don't support this. Just before the tax was introduced in 2017, 76% of South Africans supported the government efforts to cut down sugary drinks. Next. And we've had lots of changes since the health promotion levy / sugary drinks tax was introduced in 2018. As we know, we don't have to belabor this point, COVID, a lot of increased hunger, a lot of increased consumption of cheap, ultra-processed food, increased deaths from non-communicable diseases, particularly diabetes and hypertension, and strong evidence across the globe that sugary beverage taxes work in other countries. Next. So this is just to show you that hunger in South Africa since COVID has been well documented. You can see on the left where these people live in metros, cities, and rural areas. It's most obvious in the rural areas, but it's significant across the country. And on the right, you can see the number of people, percentage, in the past 7 days before this study was done who were hungry. And it's significant. As I said before, more in the rural areas, but certainly in metros and cities. Next. And this is what's happened as a result of our huge number of people with what we call comorbid conditions. What are comorbid conditions? They're people with diabetes who also have hypertension, people who have hypertension and cardiovascular disease, who also have high levels of fats in their blood, as well as diabetes. And these blue circles, the whole circle is showing you by age group how many people were hospitalized. So if you look at the biggest circle, that's 70 to 79 years, okay? But what that blue circle represents is people with non-communicable diseases that have been hospitalized with COVID. The red ones are the people with HIV, and the green ones are the people with TB. But the vast majority of people who are hospitalized with COVID at all age groups, okay, probably with the exception of obviously the youngest age groups, because that's not when they have these non-communicable diseases. Most of these people who were hospitalized with COVID also had this condition, these conditions. How much better off would we have been if we could have just switched off the tap to prevent diabetes and hypertension like we did with alcohol? That's just not possible. Next. So in terms of the global findings across many jurisdictions from Mexico to Berkeley to Chile and Saudi Arabia, these taxes have worked. They can help dampen the demand for sugary drinks and shift the demand to healthier alternatives. And in some places like Mexico, they have both a tax on sugary drinks as well as another tax on junk foods. In general, across the globe, there has been no net change in employment due to these substitutions. Next slide. And let me just say that during COVID, the industry has jumped right in. Coca-Cola has said, we will be donating beverages to healthcare workers and setting up hand washing stations. We are prioritizing health, but they are also prioritizing their product. And similarly, your favorite classics are back for KFC. The most essential, non-essential is back. It's interesting how KFC sees themselves as non-essential. Next. And furthermore, this was from, I can't remember, a couple of weeks ago, Sunday Times, the new head of Coca-Cola toasts the resilient Coke South Africa, and they are doing a major deal with the sugar industry. Next. So here's the bottom line in terms of what our research has found. The changes in household purchases, drawing on a Kantar panel of households, primarily in urban South Africa. We looked at estimating the changes in volumes, sugar, and calories of beverages with the introduction of the HPL, of the sugar tax. Next. And we found 1 year following the tax, there was an increase in prices of taxable beverages. So it did actually happen. The tax was passed through to the consumer. The non-taxable beverage prices have not changed much. And there has also been reformulation. There was reduction in the sugar content and the container size of these beverages. So it had the impact that Corne suggested that these kinds of things do, and it has worked. Next. So there are large reductions in taxed beverages intake post the HPL. So this has happened both at the national level, where the urban household purchases of taxable beverages by volume fell by 51%, with a 29% decrease in sugar intake. And similarly, in both Langa and Soweto, similar kinds of things. Langa, there was a survey of young adults. Self-reported taxable beverages showed a 37% reduction by volume and a 31% decrease in sugar intake. And in Soweto, a study of teenagers, young adults, and older adults, the frequency of sugary beverage intake amongst the heaviest consumers, really interesting, fell from 10 beverages per week before the HPL to 4 beverages per week after 1 year after the HPL. Really interesting. Thanks. Next slide. Furthermore, the lowest socioeconomic urban households are responding more in absolute terms in their reductions. This is addressing the health promotion goal of what's called the health promotion levy. Okay? The lowest socioeconomic urban households are filled with people who are most vulnerable to diabetes and hypertension and not getting good care for their diabetes and hypertension. They are the ones most likely to end up with amputations, with renal failure, and with blindness. Next. So the value of increasing the HPL rate, if we could do so, would be a long-term impact on weight gain and a direct impact of that on reducing the risk of diabetes, hypertension, and other non-communicable diseases. Doubling the rate to the original proposed 20% could really enhance the impact of the HPL, and fruit juices really could be added. Next. So what are the key messages? Firstly, it looks like the HPL is working. There are volume reductions by consumers. The industry has been responsive only because there was mandatory legislation, and they have responded in terms of reformulation. We know that that industry in general never responds to voluntary pledges. We've done some work on that as well, and happy to talk about that afterwards. Heavy consumers and poor consumers decreased their intake. And non-communicable diseases continue to grow in South Africa. It's not high enough. COVID has emphasized for us the importance of preventive policies at the population level. Next slide. So, to achieve our health goals, prevention is critical. We must address these epidemics with taxes as one possible lever. Mandatory food labeling. People have no idea what they're eating in their food in South Africa, zero. And a mandatory comprehensive marketing bans, especially for children. Thank you. Next slide. Thank you very much. Thanks, Pontsho.
Thank you so much, Karen, for that informative presentation. I think one of the biggest takeaway points there is around how early studies are showing the success of the health promotion levy, and we have to ask ourselves, is this enough, and what more can be done? And perhaps to respond to both Corne and Karen's presentations, we have adjunct professor at Wits University, Michael Sachs, who also used to work in the Treasury's budget office. Michael, we are looking forward to hearing your thoughts, and what do you think, what is the way forward, and what more can be done, particularly when we're looking at the health promotion levy and increasing public health outcomes that favor South Africans?
Thank you, Pontsho. I would just preface my comments by saying I'm entering this discussion very much as a generalist. I don't have specific expertise in the way that both Karen and Corne have. And I think their presentations have been extremely insightful and useful. And they show that the health promotion levy has been really an outstanding success in changing behavior and addressing an important component of South Africa's development goals. So I was reminded, and I want to make a few points, and I suppose my points are from a general public finance point of view. And I was reminded when Corne was quoting Adam Smith that something else important happened in 1776, and that was the American Revolution, which was fought under the slogan of no taxation without representation. And what that reminds us of is that before we get into technical arguments, it's always important to remember that taxes are fundamentally political. And I think the health promotion levy is probably an outstanding example of the success of South African democracy. Because as Karen points out, you have very well-established interests. And we should remember that some of those interests may be malignant, but also there are some people with benign interests who may simply be, who may not understand their own interests properly and need to be persuaded. And democracy provides us with a place where the Treasury, academics, business, labor, can engage in Parliament and arrive through deliberation and persuasion and balancing interests at a solution that works. And I think that is certainly what has happened with the health promotion levy, and probably will be happening again as we consider the increase in the effective rate from 10% where it is now to 20% as proposed. So I think from a public finance point of view, the first lesson you learn is that taxes on consumption should be, as far as possible, broad-based, number one. In other words, they should cover a wide range of products, as wide as possible. And that's why there's a preference for VAT amongst Treasury officials, one might say. But also, if your purpose is raising revenue with the least cost, you should focus on products that are highly inelastic. In other words, things that will that you will impose the tax and people's behavior will not change in response to the tax. So there's a preference within treasuries for broad-based taxation on consumption. And if it's not to be broad-based, if it's to be narrowly focused, it should be on highly inelastic products. And I think, I mean, that's really the explanation behind the fact that we have two kind of elements of taxation on consumption. The first is VAT, which is broad-based. But where we have the taxes directed at particular commodities, they're on highly inelastic commodities. The most important is petrol, which attracts high levels of taxation. And again, there are a whole lot of arguments around petrol and the externalities and environmental consequences of consumption. But also you have tobacco and alcohol that have quite high inelasticity, despite what Corne was, I mean, of course, you have an impact on behavior, but they're also dependable sources of revenue. In the case of the health promotion levy, it's almost entirely the opposite from those two principles. It is the most narrowly based tax. It's probably the most narrowly based health promotion levy that we have in the world, because it's not even focused on a class of products. It's focused on a particular input into those products. So it's very narrowly focused. And as the evidence has shown in Karen's input in particular, demand is highly inelastic, is highly elastic, meaning that there has been substantial behavior change in response to the implementation of the levy. And what this tells me is that really we're not dealing here with a tax that is intended to raise revenue. We're dealing with a policy measure implemented through the tax system that is intended to change behavior. And if we think about it like that, it has been an outstanding success. Of course, the revenue that was that accrued in the first 2 years of the implementation of the levy was far in excess of the initial estimate that Treasury put forward in its budget. So in 2018 and 2019 fiscal years, the revenue that came in was far more than had been budgeted for, and it amounted to around 3 billion in the first year against a budget estimate of about 2.5 billion. The revenue, because there has been a behavioral response partly, the revenue declined in the second year. It's probably too early to conclude about what will happen. Of course, 2020 is going to be an unusual year for a lot of taxes. So it's probably too early to conclude that the revenue is on a declining path, because 2 points never make a trend. You need a third point to make a trend. But in a sense, we want the revenue to decline because we want the behavior to change. And I think this is a very important point in general about taxation, which is that taxes do change behavior. And I think, so we have to remember, whenever we see tax proposals being made of any kind that don't take account of the impact of the tax on behavior change and the consequences of that for the revenue that will be raised, we need to be suspicious of those proposals. And I'm not talking here about the health promotion levy. I'm talking about other things. Also, we should be careful about perverse changes in behavior, which I think Corne alluded to, where at least as far as cigarettes are concerned, we have to ask the question, and again, Corne is in a much better position to provide answers here, but we have to ask the question whether further increases in taxation on cigarettes will lead to the behavior change we desire, which is less smoking, or to the perverse behavior change of the rise of illegal or illicit cigarette industry. And certainly from a Treasury and a tax point of view, that's a very worrying development, because not only, of course, it's a problem from a health point of view, but from a Treasury point of view, it's a worrying development because you're losing the tax handle, because illicit cigarettes not only are worse for your health, but from a Treasury point of view, more importantly, we don't get the tax revenue from those. So, and if that is allowed to snowball, it can be a big problem. So we must always keep our eye on those things. But there's no evidence that I have seen that this applies to the health promotion levy. I think the third point, and I've got 4 points to make. The third point is that design matters in taxation. That the way you can have a general idea about this tax would be good, but the specifics of how you design that tax are fundamentally important. And in the case of the health promotion levy, I think South Africa has been extremely innovative, because the schedule of kind of marginal increase in the tax rate for per gram of 100 milliliters per gram of sugar, I think is quite innovative. The UK had a two-tier system, and I think Mauritius also had something similar. But in a sense, South Africa went out on a limb and tried an entirely new approach. And I think that's also a testimony to the strength of democracy in considering these issues, that we ended up with such a good design to our taxation. And it may be that the design has actually is one of the explanatory factors behind the effectiveness of the tax in the last 2 years. Because as Mornay points out, it's not only about changing behavior of consumers, it's about changing behavior of industry and reformulating products. Because the new behavioral economics that has emerged in recent years has very important implications for the design of tax policy. That behavior change is not simply, of course, the price mechanism and the downward sloping demand curve that Corne spoke about are fundamentally important, but there are many other factors behind the change of behavior. For example, one of the findings that I found particularly important in the behavioral economics literature is that people always go for the regular. So if you've got a supersized Coke and a small Coke and a regular Coke, people tend to order the regular, whatever the price is. So the size of the big one and the size of the small one and the size of the regular one, which is in between, is an important consideration, but that can't be affected by tax interventions. That is where you need some form of regulation. So lastly, the last kind of point of view from public finance is that Treasury officials will always resist hypothecation. Hypothecation meaning, in simple English, ring fencing. And why? There are very good reasons why they resist ring fencing. And there are very good examples of those reasons in South Africa today. For example, we face a fundamental fiscal crunch that is putting pressure, for instance, on the health sector, and will continue to put pressure on the health sector in the years ahead. But on the other hand, we have a skills development levy, which is hypothecated, which is ring-fenced, which shifts resources into SETAs, which are unable to spend those funds. And so the funds accumulate there in a relatively inefficient place. And maybe it was a good idea at first, but clearly you would prefer in the current conditions to be able to shift that expenditure somewhere else. And that option is not available to us. And I could make similar remarks about, for example, the UIF or some of the petrol levies that are also hypothecated. But although hypothecation is resisted, in the case, maybe to go back to my original point, taxation is political. And therefore, it's sometimes important as part of the discussion over a tax to bring in what will we do with the revenue. So in the case of the health promotion levy, there was a soft ring fencing, an agreement to increase expenditure on health promotion coinciding with the introduction of the levy. And I think this is good, and this is the way to go in a sense if we go forward with a 20% levy. I would think that rather than health promotion, there might be other things that we can think about to kind of sweeten the introduction of a higher rate for other stakeholders. The two that come to my mind would firstly be some form of a just transition in the cane growing sector of the economy. South Africa is a major producer of sugar. This is not a tax on sugar. It's a tax on sugar sweetened beverages. It's important to always make that distinction. But there are issues to be raised in the sugar sector. And it might be that some kind of sweetening of the just transition to different uses for sugar, for instance, to incentivize that or make it easier might be one way to link increased revenue from, if that comes about from an increased rate. The other is that, as Karen pointed out, hunger is a major problem in South Africa. And it looks as though, from some preliminary results I've seen from elsewhere, that in the last couple of months of 2020, what we have seen is a rebound in employment, but hunger remains stubbornly at the elevated levels it was during the lockdown. And one of the potential reasons for this is the effect of the school nutrition program, that the fact that kids are not going to school means that school nutrition is not being provided. The school nutrition program is about a 7 billion rand program. The health promotion levy raised around 3 billion, so it certainly can't cover the whole budget. But some commitment to protect expenditure on the school nutrition program and maybe ramp up that expenditure and extend the mechanism through which it is delivered so that it is not entirely dependent on schools being open, so that it could be delivered even perhaps over weekends or during holidays, and that kind of thing might be something to consider. So I'll close there and thank my colleagues for the opportunity to make these comments. Thank you.
Thank you so much, Michael, for that contextualization from a Treasury point of view and what is possible. You know, we've heard from Corne about how tobacco and alcohol tax excises over time have, with the intention of health promotion, have decreased tobacco consumption. And, you know, what are some of the factors that influence that? Karen took us through what are some of the implications, the commercial determinants of health and the implications of our consumerism and how it works and what the health promotion levy has done over the years. And we're seeing with early studies what the success of the health promotion levy, although it's not at 20% where it was intended to be, what it has been. And within the context of COVID-19, thinking about the burdened healthcare system, what diabetes, hypertension, and other non-communicable diseases, and the implications they've had on admissions, death rates during the pandemic, and what does that mean? However, to draw it back to just the importance also of how this money can be used again for health promotion, or what are some of the implications and that are there around ring fencing, soft ring fencing, as Michael has explained to us. I will kind of encourage people to ask Q&As, as Lawrence Balati, who's the Healthy Living Alliance's program manager, also just wraps up this discussion and responds to both Karen and Corne's presentations, and thinking about that the key goal is not necessarily revenue, but how we can address sustainability and increase health promotion. So Lawrence, please kind of summarize all of this for us. Why does it matter? Why should the tax be at 20%, particularly as somebody who is focusing from an advocacy point of view? We've heard the financial implications, we've had the public health implications. Joining those two together with our efforts, or with efforts to advocate for a higher HPL, why does it matter and why should we care?
Thank you so much, Pontsho, and good morning, colleagues, and thank you very much for this opportunity. And all the speakers that have spoken before me, experts, I think our role is to try to tie down the links and try to drive the message home and in this kind of discussion. I think I just wanted to start as you loading my presentation. I want to start with the conversation in terms of why does South Africa need like a strong health promotion levy. I think it's absolutely critical that we unpack something, particularly in our messaging about the non-communicable diseases such as diabetes, calling them lifestyle diseases, right? Which often places the burden and the blame on individuals to be the one who simply individually have to ensure that they have to protect themselves or find a way to avoid getting non-communicable disease, when we know that is the commodifying, right, of our environment. If it's tobacco, is the commodifying of the food system when it comes to actually food and beverage. So I think the HPL is playing a critical role in terms of, in the short term, in terms of raising the much needed revenues on the fiscal. So, the back of the envelope and the calculation, I think you see that 5.8 billion. And this is really much needed revenue in a short term. And whereas in the long term, you look at, protecting the population's health through the primary prevention at the population level, which is absolutely critical. So it's twofold in terms of how we see this, that there is much needed revenue, but equally important so is that this is the kind of a tax that incentivizes, reduction in the overconsumption of sugar. And I think the important conversation that Michael raised about ring-fencing is that as Healthy Living Alliance, we're not necessarily advocating for ring-fencing, but because this is a very difficult campaign, I think the practicalities of making inferences and comparison in terms of at the health level, at the socio-economic expenditure level, what the tax could do is absolutely critical to connect the dots. Because sometimes it becomes difficult to talk about the 11% and the 20% and becomes too technical, for ordinary people like ourselves and the communities, whom actually have to drive the campaign and who have to lead the campaign, as well as for policymakers who have to actually make consideration and make tough decisions to protect the health of citizens and turn the tide of the non-communicable diseases. So I think there was talking about, we could have thousands of additional nurses and doctors and community healthcare workers, COVID-19 vaccine, we know funding is an issue. We're speaking about, health reform through the National Health Insurance. Those are the kind of things that will need money, and money will have to come from revenue. And we think the health promotion levy is equally an important role player in that. Second slide, please. So I think what is absolutely critical here is there was an intention in terms of introducing the health promotion levy. And I think it's exciting to start seeing data that is showing that the health promotion levy, it's working and it's doing what it intended to do. Number one, to raise the revenue in the short term, to encourage and incentivize reformulation from high sugar content to less sugar content beverages, and to reduce consumption, and in a long term, to go to the bold of addressing the obesity and its and the related risk of non-communicable diseases associated with obesity. And I think Karen spoke about this, that there have been conversation and a lot of talk about job losses, which in the country like South Africa, with triple epidemic of unemployment, poverty, and so it becomes a very emotional appeal in terms of implementing taxes and health taxes like health promotion levy, which aims to promote healthy living. So the issue of job losses have been coming here and there from the industry in particular, but we know that there have not been solid evidence that has shown a direct link of job losses to the health promotion levy in particular, particularly looking at the sugar cane, or the sugar industry, which has had multiple challenges, including, the import of cheap sugar, like from your countries like Swaziland, and other tariff and labor market challenges. So I think at this point that's one of the things that has been coming without really, which has been unfounded or substantiated with data in terms of specific related to the health promotion levy, and not overall challenges that any labor market and any industry would face. Next slide, please. So I think here, what is absolutely critical, I think, is we saw COVID-19, right, has, really unearthed, the dark side of non-communicable diseases, the pervasive nature of non-communicable diseases through COVID. I mean, the non-communicable diseases, for me, they have been a silent killer, because it's not something that, despite, HEALA and other partners and people who are working in this space, but they have not been like really a national political agenda in terms of, addressing non-communicable diseases. So I think COVID-19 really brought us back to the reality, of the dark side, and the ticking time bomb that we have as a result of non-communicable diseases. Many lives that could have been preserved were lost, due to the scourge of diabetes, whether confirmed or tested or diagnosed or undiagnosed. But when COVID-19 came, it actually unearthed, the part and the dark side of actually a non-response, and an urgent need to actually address and seriously look at addressing, the scourge of non-communicable disease. So the COVID-19 really painted a very bad picture of the situation that we all knew, of the situation that we all understood. But I think the pervasive nature, due to people who had comorbidities such as diabetes, obesity, and hypertension, we saw, lives being lost, and I think this brings back us to the conversation of the need for urgent response to non-communicable diseases as part of COVID-19 response, but also post-COVID-19 time as the country. So I think, where do we go from now? I think for me, it's what is critical. I think, what are we learning from, the tobacco control campaign? And what are we learning actually from the HIV campaign as well? Because I think it's absolutely critical that even on the non-communicable disease, we can have a multi-sectoral, multi-stakeholders response in a way that is coordinated, as a national response, in order to address the scourge of non-communicable disease. And I think the media has an absolutely critical role in driving the message and raising awareness and making sure that we can put a platform that can start to unearth and really put serious work in addressing the non-communicable diseases. I think I'll stop there. Thank you so much.
Thank you so much, Lawrence, for that. And, now just reflecting on all the presentations that have been given, it is quite obvious that when our Finance Minister Tito Mboweni does give his budget speech, it will be grim. We should expect to hear some challenges for our economy, and with everything that has been happening, particularly the pandemic, we are going to hear about the brutal effects the pandemic has had on our economy in general. But what is also clear from some of the points that have been made in this webinar is that we cannot afford to ignore non-communicable diseases anymore. And also particularly in the context of COVID-19, how it has exacerbated in many cases the outcomes, particularly for people who have severe cases of the virus. But when we're looking at this issue, particularly from a point of view of what needs to be done. Has South Africa done enough in the past few years to ensure that diabetes and hypertension and other non-communicable diseases do not continue to ravage South Africans as much as they've done? We know that diabetes has been the #1 killer, particularly in South Africa for a number of years, and there are some, and this could be avoided by, as we've seen with the evidence that has been presented to us through excise taxes as well as the health promotion levy. But this levy is not effective if it is not at a point where it can show a dramatic decrease. We know that the failures to adequately address non-communicable diseases over the past 2 decades has also meant that COVID-19 has impacted particularly low-income communities in South Africa, have been hit more, whether we're looking at undiagnosed cases of diabetes or hypertension, but the comorbidity danger is real, and it's something that we should take into consideration when we are planning for health promotion programs. And I just want to bring back Corne right now to think about what else can be done beyond just excise taxes, and is there a point where we can get to a place where the revenue, it's not just about bringing back the revenue, but does it matter that however little revenue that is coming back into the fiscus from these health promotion levies or excise taxes, does it matter? Can it make a difference in alleviating some of the pressures that our economy is facing at the moment? Corne, are you able to just explain that for us?
Yeah, thanks very much, Pontsho. And it's a tricky question. So money is fungible, and what we mean by that is that it doesn't matter where it comes from, it can be used to fill holes. And you're quite right that there are many holes in the budget right now, and the minister would be looking under every nook and cranny to try and find more money. So now is a particularly good time to, if you don't even buy into the public health story, but certainly buy into the revenue story, that this is an appropriate time to think about alternative sources of revenue. And of course, everybody would like to have the tax passed on to somebody else as opposed to themselves. I think that's human nature as well. So we need to keep that in the back of our minds. An issue that I do want to raise on tobacco taxation specifically, and it's something that Michael raised and that I started off with, and that is the problem of illicit trade. Illicit trade in tobacco is a very significant problem right now. It has been made much worse by the sales ban, where effectively distribution channels that had been already pretty well established in the illicit market had been developed further, have become more entrenched, have become deeper, and we also see that probably more cigarettes are being sold illicitly now than even before the ban. At that point in time, it was in the order of 30%, possibly slightly less, but it's a problem. There are ways of reducing illicit trade. For instance, through track and trace systems, through mechanisms that have been described by the by the illicit trade protocol that's part of the Framework Convention on Tobacco Control. That is, or those mechanisms are available. We, for instance, don't have follow your customer type of policies that should be applicable to tobacco producers, where we keep them accountable, not just of selling the stuff, but making sure that it's being sold to people that they have done decent checks on, etc. So I'm not sure if that completely answers your question, Pontsho, but I'd like to leave it with that. And if people do want to talk about that, they're more than welcome to do so.
Thank you so much for that, Corne. It does kind of shed light on what I would have liked to know. Karen, I'd also just have a follow-up question for you. You know, given what we have talked about and thinking about how comorbidities have put the country's public health system, particularly the primary healthcare system, in so much, has burdened it so much. And thinking also about, I'm remembering a 2018 study that was done by PRICELESS, you know, where it showed that over 2.7 billion rand was used to diagnose, treat, and manage almost about 250,000 cases of type 2 diabetes. And also looking at the additional cost that goes to treating, diagnosing, and just essentially taking care of people who might have diagnosed and undiagnosed diabetes. And what does this mean for expenditure within the national health budget? Do you think that if we focus on these policies that are put in place to discourage us as consumers to buy less sugary drinks, to know more about what's in our food, and for policies that force industries to declare more, and so that we can make this revenue, or that these taxes and health promotion levies are there? Do you think that this would make in the long term, would this make a big difference in the burden of care we see in our the burden that we see in our healthcare system, rather?
Thank you, Pontsho. That was a very helpful question. I must say that I agree. It really could make a huge difference. There are many countries that are doing this now. One of the first countries that tried to address these issues was Finland, for many years, and it's taken a couple of decades for the burden of these diseases to really significantly drop in Finland and other countries in the West. It's interesting to me that Boris Johnson who was overweight at the time, got really sick with COVID, was hospitalized, and from that experience he decided to put marketing bans into place in the UK and food labeling. So yes, I think it could make a huge difference, and it must be a multi-pronged effort. It can't be a single thing, but it must be inclusive of all three of the issues that I've spoken about. And it really is linked to hunger, because many of the children who are very hungry and stunted and wasted in South Africa are at even higher risk of becoming obese as a result of sugary beverages and other junk foods that are high in sugar. So we have to do everything we can to decrease that. Thank you, Pontsho.
Thank you so much, Karen. And lastly, Lawrence, as HEALA, where you advocate for policies that protect the well-being and empower South Africans to make healthier food choices and to increase equality and within our food system, what are your last parting thoughts about the health promotion levy, and what do you think it will take for it? For our government, for South Africans, for all of us to believe in the levy being 20%, as how the World Health Organization has shown that's where we see a lot of results and where we see the benefit of the health promotion levy the most.
Thanks, Pontsho. I think it's a public campaign. So a very multisectoral approach campaign that is built nationally in communities with understanding, right, of taxes and how the promotion levy work, health promotion levy work. I think the media has an absolute critical role in carrying the message, in raising the awareness, in actually advocating as well, because I think we all can consume and get information mainly through media. So I think this is part of a continuous struggle in building, the narrative and the advocacy and amplifying the advocacy. And I think our role is to mobilize society, to mobilize people who live in this country to first understand, my colleague Karen usually says, the campaign with tobacco, we already knew that tobacco is harmful before there was even a front of pack labeling and taxation. But little did we know, most of us, before we actually started doing this work, the risk associated with, sugar, high sugar content, salt, and fat. So I think it's a campaign that needs to build, that needs further building stone in terms of raising awareness and mobilizing South Africans and people who live in this country to have a collective response and a multisectoral approach.
Thank you much, Lawrence. Fact, COVID-19 has upended our lives and has put unprecedented pressure on our healthcare system. Another fact is that diabetes has contributed a lot in hospitalizations of COVID positive patients, and also in the death rates, as we've seen in studies that came from the Western Cape, and also in the National Institute for Communicable Diseases analysis about hospitalizations and how they happened. Another fact is that the health promotion levy and other excise taxes have worked to generate revenue back into the fiscus. Now more than ever, we need that. Another fact is that studies show us that it's not just the narrow approach of the health promotion levy, particularly looking at sugary drinks only, that is needed. And these are some of the complicated realities that we find ourselves in as we prepare and as we anticipate Finance Minister Tito Mboweni's speech in the coming weeks. But at the end of the day, we need to think about how to find a middle ground that works, where health promotion is taken seriously, where the public health and the outcomes that we need for a healthy South Africa are taken into consideration, and everything else that has been discussed today. I'd like to thank all our panelists, Corne, Karen, Lawrence, Michael, for all their contributions to helping us understand this very complicated time and space we find ourselves in, and also some of the solutions that we can implement and take into consideration while we try to have a better, healthier, more economically stable South Africa. Thank you to all our attendees and all my media colleagues who joined us in this discussion. Do feel free to reach out to RHAP and HEALA and all our speakers today directly for more information on this sugary drinks tax to health promotion levy and how to end it all. Thank you so much. I'm Pontsho Pilane.